Heartburn is a condition in which you feel burning behind your chest, and it can be a symptom of reflux. A lot of society uses heartburn and reflux interchangeably. Reflux is the medical term given to the feeling of stomach contents coming up into your esophagus, with heartburn being one of the common symptoms. It's pretty common in our society. About 20% of the population is estimated to have symptoms of reflux. And it's important to control, one, for quality of life, but more importantly, it can increase your risk for esophageal cancer. And it can also increase your risk for developing something called a stricture, which is a narrowing that develops in the esophagus from inflammation that's untreated. So a lot of studies have been done on heartburn, and there's a lot of theories on what can improve your symptoms. The two things that have been proven in the literature, one is reducing weight if you're overweight, or if you've recently gained weight, then dropping back down to your baseline weight level can really make a difference in improving your symptoms. Number two is elevating the head of the bed by placing either a cinder block and raising it by 6 to 8 inches, or buying a wedge in a surgical supply store. It can really help to reduce symptoms, especially at night, by having gravity work in your favor so that acid contents don't come up as high and cause symptoms. Food is an individualized decision. Some patients, certain foods do trigger their reflux, and in other patients it doesn't. So some of it is trial and error. But the broad categories of foods that stimulate reflux in some patients: spicy foods, carbonated beverages, caffeine, chocolate, and fatty foods. The bottom line is that reflux is a condition that does affect patients, and it really can cause symptoms that affect the patient's quality of life. But medicines aren't the only option. There's a lot of things that we can do at the home, both with our diet, our lifestyle, the way we eat, and the way we sleep, to help improve our symptoms. And there are patients where diet and lifestyle don't improve their symptoms, and that's where medicines and even surgery play a role.